and it will cause dental caries that will cause a problem throughout your pregnancy. If you have just had morning sickness and you vomited, what should you do? It's not a problem, do what you need. I was like, oh, doesn't sound like such a big deal.
Hello everyone, welcome to another episode of ziRight Girls. Did you know that September is Oral Hygiene Awareness Month?
Today we have a very special guest with us in the studio, Dr. Alexander Abedian Drawani. He is a cosmetic dental surgeon, a community dentist, he's a university lecturer. He has launched South Africa's first dental care range, of which the first product is an electric toothbrush available in stores now. And you may know him as Dr. Smile. Please welcome Dr. Smile.
Thank you, ziRight Girls.
Yeah, ziRight Girls.
Nice to meet you, doctors. Thank you so much for having me.
The aim of today's episode is to bridge that gap between dentistry and obstetrics, especially in this episode, as we see a lot of women who have dental conditions, which is obviously outside of the normal scope of what we practice. And so we would like to, invite you to join hands with us so that we can educate our shared patient population.
Well, I'm very happy to help. See,
yeah,
hopefully
literally.
I can.
Yeah, we thought about this topic after I received a call from trauma about a patient who had come in severe toothache.
Right.
She's pregnant with twins, and nobody would want to touch her. So even dentists don't want to look after pregnant patients. So basically, we just want to talk about
Why not?
Why can't we look after pregnant patients, and what can be done for pregnant patients.
Okay.
So I think let's get right into it. So pregnancy comes with a lot of challenges, and one of them may be a change in your oral health. So there are lots of changes that happen to a woman's body during pregnancy. The hormonal changes generally do make your veins swell up. So this can also lead to some conditions that can affect your health, your oral health. Today, Dr. Smile is going to tell us a little bit about common conditions that are encountered in pregnancy.
Right. Perfect.
So, Dr. Smile, when ideally should a lady who is pregnant or who is considering becoming pregnant see a dentist? Do you recommend before, during?
So, holistically, prevention is always better than reactive treatment.
Yes.
True.
In any field of healthcare. So, anyone planning to get pregnant, that's the best time to go to your dentist, get your regular cleaning, do a full thorough consultation and examination. If you have any problematic teeth, fix the problem then so that you can have a nice, smooth pregnancy. Because as you very correctly said, pregnancy and estrogen and progesterone make the body go wild, and there's always a lot of consequences on your normal body and obviously your mouth. I want to clear up some concerns. Dentists in general, and we were also taught in university, like if someone's pregnant, stay away, be careful, oh my God. And I used to have this approach. And then as I started asking, because it's always important to speak to colleagues, right? And there's so much guidance to say, okay, if you have any concern for your patient as a dentist, contact the obstetrician of your patient and check. It's not a big deal. I did that once, like many years ago. I didn't know. I contacted the obstetrician. I'm like, yo, is it okay that I give like a little injection because I need to do this? They're like, why are you dentists always worried about local anesthesia? It's not a problem. Do what you need. I was like, oh, doesn't sound like such a big deal. Anyway, I mean, if we look at the American College of Obs and Gynae, they even say now, periodontal, restorative, preventative care through during pregnancy, it is okay. This is really important for people to understand. It's okay to go to the dentist. Obviously, you don't want to do elective procedures that are not necessary. So if you have a teeth whitening, leave the teeth whitening. There's not enough research to say what does that carbamide or hydrogen peroxide do if it gets into the saliva. There's not research on that. Because there's not research on that, just leave the whitening. There's not enough research speaking about what hydrogen and carbamide peroxide do to the baby, so leave the teeth whitening. That's an elective cosmetic procedure anyway. But any cleaning, restorative work, you need a little bit of local anesthetic to do a filling, get your filling done, no problem. And you're safe in any trimester. If you have a choice, however, and if it can wait, the smartest guidance is to wait to second trimester. This is a general rule. Wait till the second trimester, and preferably to the end of the second trimester, because with increased gestational age, the baby is already safer. Especially from a perspective of if you need to take x-rays. I mean, we know that if we want to take radiographs, we're obviously limiting it here, and we used to shield with a lead apron. But it's interesting, there's a 2023 study, that the American Association of Obs and Gynae has shared, saying we don't need to shield from dental radiographs anymore. Which is already it's quite like you're pregnant and you don't need to shield?
That's already a bonus.
Okay, it's already a bonus, but it's not a big deal. You wait if you can to the second trimester. And if you can't wait and you're in pain, don't leave a periodontal problem or an abscess or deep caries, because the consequence of that on your body, on your nervous system, on your sleep, on your eating, on your well-being can have further consequences to the baby. Exactly. Other than a little bit of local anesthetic, which all the local anesthetic, even with adrenaline, has been shown to be safe. It doesn't pass the placental barrier, and we're not concerned about it. I often speak to specialists and obs and gynae specialists up to very recently, and I was asking them about local anesthetic, and they said, no, doesn't cross the placenta, it's very safe, you can use it at any time during pregnancy, obviously be conscious of toxic doses. And so why I'm saying this is because it's not a big deal. You can do fillings, you can do periodontal work, you must definitely have your cleaning pre your pregnancy and throughout your pregnancy. As you very correctly said, the hormones create gingivitis. Gingivitis is inflammation of the gums. Now, normally under normal circumstances, gingivitis happens because of a biofilm in the mouth, right? Biofilm of plaque, bacteria, etc. that causes gingivitis. But during pregnancy, you get this inflammatory response, which is not necessarily in response to the biofilm having changed or not. It just happens. And so you want to make sure that you have a regular cleaning so that it just limits the symptoms and it doesn't turn into anything worse. I think holistically, in summary, you can happily get your dentistry work done. And quite a lot of the antibiotics are even safe. So you were referring to, so if someone has an abscess, well, that's acute inflammation and infection. You're not going to leave that in the body. That's here in the head. That's going to circulate around the body. Who would ever leave that? You can take penicillins in pregnancy. It's completely fine. You can take clindamycin. You can take metronidazole. You can take these antibiotics. You can take them should you need, but you can also just give the person local anesthetic and sort out the source of the infection. And voila. And then let them carry on their pregnancy. No problem.
An important point that I'd also just want to add on to that is we know as obstetricians that any infection, results in prostaglandin release. Prostaglandin ripens the cervix. So leaving an untreated infection very well may result in a miscarriage if you're in your first trimester, or preterm labor if you are, pre 34 weeks. And so for that reason, it is important that if you have symptoms, that you should get a referral to a dentist or
specialist,
oral health practitioner, and have that sorted out. And as you quite rightly said, a lot of the antibiotics that are used in the oral region are antibiotics that we use generally throughout pregnancy as well. So they are safe.
Something I wanted to mention, now you were speaking about the effect that has on prostaglandins. There was a 2016 systematic review, like 23 studies, which tried to show the link between periodontal disease and preterm pregnancies, preeclampsia, low birth weight, it's not conclusive evidence, but they did a systematic review of 23 studies and they could see links. Now, so even though it's not something conclusive, it's like, don't leave periodontal infections in your mouth. There's enough problems. Go and sort it out, because we know that the consequences of not sorting it out outweigh anything that we've currently found in normal dental treatment.
So you've mentioned quite a few important pointers that our clients are often very worried about. So maintaining their routine oral cleaning. So
Yes.
before pregnancy, during the pregnancy, there's no limits. If you need any procedures done, it's in the second trimester. It's often the best, because
Ideally.
we have now in the fetal stage, the embryogenesis is concluded. So most of the things that we are worried about, drugs and
Correct.
X-ray imaging affecting a developing fetus, the risk is very minimal. Thank you very much for that insightful.
Yeah, I hope that
summary.
helps clarify things. I think what basic things we also want to know and help mothers with is like, what is my basic routine? Like, what do I do? How do I look after my mouth? You know, and basics from a perspective. Okay, when you brush, when you floss, what do you do? So this is what happens in pregnancy. We already know that we get inflamed gingiva. Cool. And we already know that that is a reaction to hormones, but
Sorry, can I just interrupt you? Gingiva is gums for our
Gums.
audience.
I'm wearing this for gum color also, not for
But the ziRight
not
girls
for-
is pink.
not for gynae color, but gum color, but it's similar. So this is what happens. We know that our gums swell. And that's normally in response to bacteria. Okay? In this case, it's hormones and bacteria. So your routine at home is a twice a day brushing. Okay? And that's for average of 2 minutes. And that's gentle massaging circles, your whole mouth, all the surfaces, the outside, the inside, the top, the bottom, etc. The in-betweens of the teeth, you need to floss. A lot of stuff gets stuck in between there, and it will cause dental caries that will cause a problem throughout your pregnancy. So we don't want to let that happen, because what's the reality? From the beginning of your first trimester all the way through to birth, as a dentist, it's very rare that I see patients until like 4 to 5 months after giving birth. They at home with baby. So if you get a hole in your teeth in like your first trimester and we don't see until a year later, it's a whole problem. So
No pun intended.
let's so we're going to, so your basic brushing and flossing is important. Okay. What also happens in pregnancy, we have a lot of morning sickness, we have reflux, we have vomiting. This is all very acidic. The mouth is not good with acid, right? The enamel and the teeth are not good with acid, but the bacteria love acid. So if you have just had morning sickness and you vomited, what should you do? This basic insight. Let's go and rinse with water first. You can even take a little bit of toothpaste and just put it in your mouth, because it is alkali and it will help buffer the acids. So never brush your teeth after vomiting. Don't do that. I know it feels like you want to go and brush. Don't. You're going to damage your enamel. Just go rinse and put a little bit of toothpaste and let that buffer the acids.
Okay.
If you have reflux, same concept applies. Never brush after an acid attack. You need at least 20 minutes for your saliva to buffer, and then you can really go and brush. But rinsing will be sufficient.
And what about mouthwash?
Mouthwash, I'm not a
Non-alcoholic ones,
I'm not a
obviously,
fan of
for
mouthwash.
pregnant
Mouthwash, I only ever advise to my patients medicinally. If they've had gingival or gum surgery or an extraction, or an infection, periodontal infection that we're trying to help heal, you almost use it as an antibiotic, topical antibiotic. But don't just use mouthwash, right? You don't need to. Your saliva is your mouthwash. However, in pregnancy, your saliva becomes sometimes a little bit more acidic. But the point is, you should just rinse. Water is going to be your biggest friend, okay? So brushing, flossing, rinsing with water after any type of acid attack. Obviously, pregnant mothers love to snack. That's very normal. And they're also tired. My sister is currently pregnant. She's in her second trimester. And they're tired. And you want to snack. And so obviously you don't want to get up and brush your teeth all the time. And now you must go to sleep. And now you must go and floss. Dr. Smile said to floss. I'm not interested in flossing now. I want to sleep. I've got a whole human growing in me. So when you have all of these factors, then this is important. Like dads, you wake up. If she's lying on the couch, just bring her a cup of water, let her rinse her mouth at least. Do a little brush for her. I'm sure you can do that. Help her, let her sleep. But the reality is, because you're snacking and food just kind of chills in the mouth a lot more, you are more likely to get dental caries, which is a cavity, which is bacteria attack on your teeth. And so also hormonal changes and immune system and the body like allocating resources takes away from your normal immunity, if I'm correct.
Yes, it does.
And because that happens, you are more prone to bacterial attack than maybe you would be. I mean, we know many mothers say, oh, my teeth are fine, and then in pregnancy, bah.
Yes.
All right. Why? So this is
Generally.
what you can do to be able to try to prevent those things. But yes, if you can, go see your dentist or your oral hygienist every 4 months. If you know you're a one to plan for pregnancy, go make sure your mouth is spick and span. So you don't have to worry about those things.
Okay, that's interesting. So, Dr. Smile, a question from an obstetrician. I'm sitting in
No
front
pressure.
of no, I'm sitting in front of my patient who's complaining of bleeding gums.
Okay.
And I have a look. I don't see obviously anything overt. I don't really know the depths of an oral exam, but I don't see anything that's overt.
Fine.
What can I do between today and her appointment with you to tide her over, let's say, for the 2 to 3 days that it might take to get to you?
So is she concerned about the bleeding gums?
She's concerned.
Or are you concerned about it?
Let's say we're both concerned. So she's got bleeding gums. I'm not worried that it's, a non-benign lesion or a malignancy. I think it's really got to do with...
It's just a generalized inflammation.
Yeah.
Okay.
So
Okay.
what advice can I give her, besides maybe just rinsing her mouth more regularly up until now?
If it's home stuff and you haven't gone to the dentist yet, so you can't get any special oral rinse and you can't get any special this and special that, and you're at home and that's your reality, okay, what you can do? We know you're going to go and first floss. You're going to go and using a soft bristle brush, not anything medium or hard. You're going to do a nice thorough brush, a massaging brush of all the surfaces of your teeth. You can let that toothpaste sit for about a minute. Don't rinse it out yet. And then rinse out and carry on your life. People always, for example, we know this thing about saline, salt water. That has its generalized antimicrobial effect, but if the inflammatory response is not from microbes, that's not going to do anything. It might just make you feel psychologically calmer. So no, there's nothing more to do than that. You're not going to, unless again you go to the dentist and they give you a special oral rinse because your inflammation is not just from hormones. Because again, let's clarify, if it's from hormones, then no antimicrobial will help you. Because I'm not giving you an anti-hormonal oral rinse. So hormones are fine, and that's something to go through. But if it's bacterial also, we can control the bacterial part with brushing, flossing, and even maybe a medicinal oral rinse that will help. And thereafter, that's the process. So something that also happens, not so common, but it can happen in some mothers, is you get something called a pyogenic granuloma, which is a little growth of gum. It normally happens in between the teeth, and just looks like a small little balloon, or like a mulberry shaped growth of gum. This happens in pregnancy. It's an inflammatory and hormonal response. It's not a big deal. We will just clean it, and we can even just remove it for you. So don't get too scared. It happens in pregnancy to some ladies. And if something like that happens, you go to your dentist. They'll be able to identify it. And if they can't, because they haven't yet experienced it, that's why we have different specialities. So a specialist dentist for your gums, bone, teeth, growths, is known as an oral med and periodontist, oral medicine and periodontal specialist. Okay, that's a specialization of dentistry, and we have obviously different specialities. Someone can focus on root canals, someone can focus on orthodontics, someone can focus on cosmetics, and etc., etc., etc. So we have these specialities, same as you guys do, because not one person can know everything. But if we work holistically, we can always tackle a problem.
Speaking about specialities, we know that you do cosmetics, surgeries, and smile makeovers. Do you maybe want to tell us more about that?
Yes, I have grown a very special affinity and love for the artistic element of dentistry. I love to bring out somebody's true smile, either a smile that they've lost or one that they've never had. And so my area of focus in dentistry is making your smile healthy, functional, and aesthetic. People know about veneers. This is mostly what people know about, and obviously that's my area of focus. And I enjoy it a lot. It has a huge impact on somebody's mental health, emotional well-being, and by virtue of them having increased sense of confidence and wanting to look after, it severely impacts their physical health. Because oral health, really, this is the door to the body in terms of the bacteria that are in here go all over the body. We already know about that. That has been shown in studies for very many years. And so when someone looks after this, the rest of the body very often is well looked after also. So that's why I'm trying to become better and better, more and more excellent.
And can pregnant people do veneers while they're pregnant or continue in their journey?
Can they? Should they? They can, because we know that local anesthetic is safe.
Okay.
But should they? Should they be doing anything that puts the body and healing under any type of extra pressure that's unnecessary when you're already going through pregnancy? So I would, let's say, unless my patient had a severe problem that was not just cosmetic, but needed the work done because this was impacting mental health and emotional health and work and sleep and, then I would do something. But if you're completely healthy and everything's good and you're like, I want veneers, I'm like, no problem. We can do all the planning now. Okay. I can show you what it can look like. We can do your cleaning. We can make sure you don't have any holes. And as soon as you're ready, once baby is done and everything is good, let's happily do it for you. So it's not that you can't, but I think it's irresponsible if you do.
Yeah, that's true.
Okay, cool. And then you mentioned that you mentioned functionality and good mental health that is linked to good dental care. Can you tell us a little bit more about Project Smile?
Yes, Project Smile developed out of a need to be able to help victims of severe trauma. So I obviously, as we've mentioned, do this very exciting cosmetic work and makeovers and transformations. And that is all well and good for those few individuals who are able to afford it. Yes. But we have many individuals who can't. And of those many individuals who can't, there is a select group of those individuals who have been the victims of severe trauma. Rape, abuse, car accidents, burn victims, things which are really, extraordinary. And for those extraordinary patients, I offer those same treatments but for free. Okay. And so Project Smile has been doing that really for the last 10 years. And there is way more of a need than these two hands are able to do, but we continue, and hopefully it encourages other dentists to create space in their diaries to do free dental care for those who truly need and deserve it, at no charge. And then for everyone else in between, then we have government clinics and tertiary institutions for them to be able to go to. But yeah, Project Smile does that, holds a very special place in my heart, because that I can equate the feeling to when you guys deliver a baby and you're holding this life in your hand and you show the parents, which for me I would assume is like the pinnacle of a feeling. Yeah. For me, that's the pinnacle of feeling in dentistry, is when you're able to help someone out of that very deep psychological traumatic hole that they've been in, with a little bit of ceramic and resin and some skills, and they can smile again, but internally smile again, because this is secondary. So that's what Project Smile does.
And how is your dental range involved with Project Smile? So that's also very important.
Yes. So Project Smile as I said, does that work, it also does a lot of community dental education work, especially for children. Go out, go to schools, educate, give out toothbrushes, give out toothpaste, because we know in South Africa there's many areas that just do not have the resources to be able to have enough toothpaste for everyone, or new brushes, or whatever be the case. These realities that we see. And so we have a responsibility to do what we can. So my oral care range, you can actually pass me that, and you can pass me the white box also. So this is the first offering of my oral care range. It's electric toothbrushes. Very nice, very fancy, South African design, designed by me. You can see me on the box. Here I am. But what is lovely about this, other than being very affordable and a very high standard for its price, every brush that is sold, for every brush sold, I give away one manual brush for free to somebody in need. We've already sold over 1,300 of these brushes. And that just translates into not only me giving out brushes for free to those in need, but obviously proceeds from the sales go towards the Project Smile makeovers. And so I try to link these very well, because this is a South African brand. The Dr. Smile oral care brand, from this as well as the toothpaste and the floss and the manual brushes, all of which will be slowly coming out, will all contribute to that sphere of Project Smile and keep that going.
That's amazing.
It's really great and commendable.
Thank
You
you.
actually inspire us to do more as well with our
You
gifts
guys,
and time.
I was telling you guys, I know what you guys have to go through to get. I see it. I see you guys have worked incredibly hard to be special. That's mad. So you don't need to do more. You're doing so much. Thank you, both of you.
So there you have it, everything that you need to know about oral health and dental hygiene, especially during pregnancy. We'd like to thank Dr. Smile for coming through and making time to be with us today.
My pleasure.
Yeah, I hope it was as informative. We also learned a lot from this episode. Thank you very much,
My
Dr. Smile,
pleasure.
for joining us.
Thank you.
And
Thanks
we
for having
hope
me.
ziRight girls.